to maybe poor fitting wheelchair equipment, bed equipment. Falls is a very common cause for skin tears. You may see that a lot with your loved ones that you're caring for in the home. Leg ulcers, and sometimes even the dressings itself can cause pain. So if there's a glue, or on the tape, something to that nature, that can cause irritation to the skin. One thing, I don't know, constipation is one of those things that it's one of those hidden, it may not be as, you may not be as aware of it as you might be of a pressure sore, because you don't think about it or you don't see it. Constipation can be a huge source of pain, and it just may be something that, we don't think about how often our mom or dad, anybody that we're caring for, are going to the bathroom. So that's also something to consider. Dental issues, kind of like constipation, it's one of those things, especially if we have a loved one that is nonverbal. Dental issues may not be the first thought, but they're very common and can cause an enormous amount of pain. And then you have your kind of aging, osteoarthritis, muscle rigidity, those types of things. So any one of these, and then I'm sure there are several more, can cause pain and bring about those behaviors that we might start to see. And not all of our loved ones are able to tell us that these are issues for them. So these are just some of the more common things to look for whenever we're trying to assess pain. So after assessing the pain, once we do identify where the pains come from, what could be causing the pain, always, best to check with your doctor, especially with sores, any type of wounds, things like that. Let them know that your loved one's experiencing those things. But some things that we can do just to help manage the pain at home, for one, is changing positions. So, and that doesn't necessarily only go for patients that or loved ones that are bedbound. It can be for mom or dad that is sitting in the recliner chair, sitting on the couch all day, sitting in their favorite spot. Just changing a position, changing a seat, helping them get moved around is going to help to decrease pain due to, immobility. I know in rehab, and we do a lot of teaching on this whenever we're in the nursing home with staff, and then whenever I did home health, we did a lot of teaching for adaptations that you can easily do in the home. So that's cushion for those bony areas, elbows, heels of the feet, the patient's bottom, those types of bony areas, the back, that you'll see wounds pop up pretty easily, cushioning those spaces. Oral checks and skin checks. So, it's kind of a tricky, I would say, situation because I know my mom is the main caregiver for my grandparents at this point. And she does check their mouths on a regular basis. So asking that, making sure that their oral hygiene is taken care of, and whether that be, changing their toothbrushes to an automatic toothbrush instead of a manual toothbrush. That way they're not having to work as hard to get their teeth clean. But, just checking skin checks. My mom helps with baths, and during that time she does check for spots and places. So that can help, because you can really start to see the progression of a sore pretty early on. Any red spot that tends to stay red for a long amount of time, you're probably looking at, if not treated or changed position, a wound that will come on. Gentle exercises and stretches. Keeping your loved one moving around. So it doesn't have to be excessive movement. It doesn't have to be really aggressive movement, really just making sure that they're moving, stretching, getting around more so than sitting. That can also help with pain. Medications. So a lot of times, you know, we think of medications and medicating our loved ones and, you know, trying to steer clear of the medicines as much as possible. You want your loved one to take the least amount of medicine, but in some instances, using medications is very much necessary. It can help with relaxation. You know, it can help if they're already in pain, if they already have a sore, if it's already progressed to a certain point, then you absolutely want them to be comfortable. And sometimes medication is the way to go in that instance. Hydration and nutrition. So that goes hand in hand with the wounds and, you know, pressure ulcers, different things. So staying hydrated and getting the right nutrients can help not only prevent, but can also heal wounds if they have it. So, you know, a lot of protein high foods will help with that in the healing process. But just making sure that they're drinking their water. You know, a lot of times as our loved ones age and get older, their taste goes, or they forget to drink and take enough water in. So, you know, just making sure that they are eating, they are drinking as they should be. Music, I put music on there because I know that, especially whenever I worked in our dementia facility, we use music a lot, and we even use music a lot during our rehab, during our time with our patients during rehab, because it was calming to them, it helped them focus. A lot of times with dementia patients, they didn't always understand why we were doing what we were doing, especially if we took them out of their environment into like the rehab gym or what it may have been. It helped to calm. And so we could actually get, you know, more out of the rehab session once we got them calmed down. And then the last thing I have on there is like a gentle massage. So sometimes with dementia, you see, you know, touch. It's uncomfortable to maybe your loved one or to the patient. They may not understand why you're doing what you're doing. Always explain what you're doing to your loved one, but also it's just a simple touch can really calm and deflect off the pain and help distract a little bit. Okay. So this is kind of like what Jessica had in the beginning. It's just another pain tool that you can use. And you can use this at home and then also take it to your loved one's physician and use it there as well. But it's just a pain scale that I found online that I thought was really neat, that you could use to assess the pain and bring that to your physician or your loved one's physician and kind of talk about routes from there. So, you know, if you go through and you score them according to the scale here, and, you know, say they're at a super high level for pain and you bring that to your physician, at that point you can really start that conversation of what's the best route to start handling that, whether it be, rehab at home, a different medication, changing medications, or even another route, hospice, whatever that may look like. I just thought that this was a good little tool that you can use, and we'll send that in the slide. So we talked a little bit about this a couple of slides ago, and we talked about, definitely that it's okay to use medicine to help with pain. But some ways, if you're in the home and you're trying to really help your loved one at that point in time, these are just different things that you can look at to do with them in the home right away. So we'll get to the life board in just a second. But like I said, so music is calming. It helps to distract away from the pain that they may be having. And then it also provides a sense of stimulation. If you have, if your loved one is nonverbal, if they are bedbound possibly, or, just extremely confused at the end stage, it really helps to stimulate in a good way, not overstimulate, but soothing music to distract from that a little bit. So chart a life board. I thought this was a great suggestion that I found. Now I know that our speech therapy has done this in the past, and I've always thought that it was a really good tool to use with family and the patient. So it's a good way for family and patients to communicate, even if, the patient or your loved one is nonverbal or severely at the end stage. So it assists with being connected, and it provides a framework to connect to your loved one. And then, it's a visual representation of good memories of things that they've done in the past. So I've seen that really help to bring someone out of depression. Anxiety helps to calm as well. And then a lap pad, kind of exactly what it says it is. An activity lap pad, would sit in the patient's lap, have different tactile activities that they can manipulate, buttons, zippers, whatever it may be. We've seen a lot of times with dementia patients, they get very restless. And so a lot of times if they can be redirected, or if they stay busy, then a lot of times the behaviors tend to stay at bay or calm down. So a lap pad is a really good way just to bring some of that energy out and tame some of those behaviors sometimes. Is that?
The last one was a comfort blanket.
Okay. It's not showing on my side. Yes, so the comfort blanket I thought was, which I love a comfort blanket now. Basically, it's a weighted blanket. It's a type of weighted blanket. I think from what I've researched, the ones that we've used, it's been up to like 4.5 pounds. But they can range from different weights. But what that does is it's just a calming effect. You place it over the shoulders or in the lap, and it's almost like a hug to your loved one or to the patient. We've seen it sometimes used as a vest, and that sense of sensory feedback really it calms the muscles, the nerves, and a lot of times it distracts from the pain. And we've always found that the more calm that your loved one can be, the less pain that they're usually in. So that's just a really good alternative. to use to help bring those behaviors down a little bit. And yes, Sarah, I love that. I saw that. Memory books, redirection, shadow boxes. I agree. We've used those too. Okay. So on the next one, what I have found, because a lot of times, especially being in on the dementia unit, a lot of times we saw behaviors in patients, but there were no wounds. They were very mobile. So there was really no sign of pain after, assessing the oral hygiene. We knew that they were getting their medicine, the correct medicine. So, but they still have behaviors, which goes hand in hand with the diagnosis, unfortunately, a lot of times. So some of the reasons that they may have behaviors without pain is just a lack of sleep. And, you hear about sundowning quite a bit with patients with Alzheimer's and dementia. And they're up all night and their sleep routine is kind of off schedule. So that can be one of the reasons why they're having behaviors. Another reason is that they have changed medicines, and it takes a while for one medicine to leave the body and another medicine to take effect. And sometimes that hasn't quite happened completely, and so the two medicines are interacting. And you will see a lot of times over time that once the one medicine has left and the new medicine, if it's the correct medicine, takes effect, then those behaviors kind of taper out as well. Like I mentioned before, depression, even in dementia patients, we would see quite a bit of depression. And so the lap pad, the shadow boxes or the memory boxes, the comfort blanket, those types of things can really help with decreasing depression and the feeling of stress or loneliness. And then sometimes patients feel grief, especially in dementia patients. A lot of times I would see that we would have a patient that would be pretty stuck on one specific memory for whatever reason. Something has triggered, unfortunately, maybe a bad memory, or they've created a scenario that they feel is very real. And so it brings along this feeling of grief. So and you might see behaviors with that. So as I mentioned earlier, with music, it can really be great for calming as long as the right type of music. But then you also see in some scenarios, there's a round of overstimulation. And if they're in the home, that might be, a family get together. It just overstimulated them at that time. In the facility, we would see it a lot of time at meal times when there were quite a few people around. Just that overstimulation can cause them to act out, have behaviors. It's their way of expressing how they're feeling, especially if they can't put it all together in words that make sense to us. The loss of control or feeling forced to do things. So I'm seeing this a lot with specifically my grandmother as they age. They're now in their 90s. She's not been driving for a while, and she's starting to forget things. She hasn't gotten to the point where she has forgotten everything, and she does pretty good on a daily basis. But then there's times where she gets pretty confused but she knows she's confused and she knows that what she's saying is not quite right, and that upsets her. So I think it's that feeling of they know that they're starting to forget things and they know that things are changing, and that loss of control or that loss of connection that they had before, I think causes a little bit of behaviors. At that point, you can tell my grandmother's mood changes pretty drastically, and she becomes agitated, kind of upset, snaps a little bit at everybody. But it's because she's realizing that she is starting to become forgetful and that what she's saying isn't quite right. So, that type of feeling can really cause behaviors to come out, whether they're subtle at first. And then the force to do things, I would see this a lot with loved ones that would come in or in the home. The daughter or son would really get on to their mom or dad about taking a bath, making sure that they had their bath, eating their meal, demanding, you haven't had a bath in 4 days, you have to have a bath. Like those feelings of being forced to do things, even though, yes, they absolutely need to do those things. A lot of times that would entice a behavior change. So just those are things just to keep in mind when there's no pain, but you're starting to see behaviors to come out. And then, so I put this in here because whenever I was practicing in the field in home health, we would see a lot of patients with, the beginning stages of dementia, and then we would see patients all the way to closer to the end of stage. And at that point, what we really helped with was a lot of teaching for whoever, for the caregiver, and just ideas, ways to be supportive and make it easier for both the patient and the caregiver, because I think that being a caregiver is one of the hardest jobs in the entire world. So how home health would help is nursing, if nursing can be in to help with treating wounds, just providing support to the caregiver, nutrition information and education. A lot of times nursing can help with the caregiver to put their loved one on a plan for healing if they already have like a bed sore. Medication management. So, if you're a caregiver and you're at home with your mom or your dad or, whoever, and your doctor has changed the medicine, and within a week or so, you realize that mom or dad is just different. It's not the same. Nursing is on call to help. So you can call a nurse at any time of day, 24/7, and they can, address the situation with medicine. They can talk to the doctor, make sure that the medicine is the right dose, it's the right type of medicine. If it's not, get the medicine changed. So you have a support system with nursing. Therapy services, like I said before, really can help increase the movement, circulation, prevent wounds. Like I said, they do a lot of teaching for the caregiver. So teaching a caregiver maybe how to stretch mom or dad, how to transfer them out of the bed or off the couch or out of the chair safely, so that everybody's safe for caregiver and for the patient. And then they provide assistance with a lot of the equipment. So if there's a wheelchair that the patient's using may not be the right fit, it may be causing wounds. So a lot of times therapy can help, if there's new equipment needed, because as the dementia progresses, sometimes, equipment changes, the needs for equipment change. So therapy can, a lot of times to get new equipment, there has to be like a rehab note or something along those lines. And then also I know with speech therapy, they can assist a lot with cognition and training for everybody to set a schedule. A lot of times schedules help with keeping behaviors down and keeping everybody on track. Also communication and oral health. So speech therapy can look at, as the disease progresses, ways to help be able to communicate, whether it's a communication board or a piece of technology, things like that. And then a lot of times there's a nurse aide that can come and assist with bathing. So a couple of times a week, maybe even 3 times a week. That's something that can be very helpful to you as a caregiver, to take a little bit of that off your plate. And then social services a lot of times can help get community involved, with like ramps, things like that, just resources that the community already has that you can take advantage of. The bottom of my screen is cut off.
I'll give you a rest if you want me to.
I think I'm just like so pregnant that it's hard for me to breathe. That's okay.
Well, I don't mind at all. I know there's an echo. We're in the same room. Let's see. Okay. Okay, guys, I'm sorry. We're going to go through, and we're not done with Tara yet. What great information she shared this evening. But I thought I would help and kind of go through true false as you all kind of maybe think of some questions that you'd like to ask Tara, or comments of things you all have gone through always. So the first true and false question is number 1, there are no signs to look for if your loved one cannot tell you they are in pain. Number 2, pharmaceuticals and medications are the only way to ease pain for your loved one. Number 3, music and a comfort blanket are 2 ways to decrease behaviors and can distract from pain. And number 4, home health can be a good resource for support and treatment to decrease and prevent pain in loved ones with dementia. So I'll give you just a few seconds to kind of think about those, and then we'll go ahead and we'll give you all those answers. So number 1, there are no signs to look for if your loved one cannot tell you. Tara discussed this in lots of detail this evening. That is false. There are facial expressions. There are ways to see signs of pain in your loved one if they are not, if they cannot verbally tell you that. Pharmaceuticals and medications are the only way to ease your pain for your loved one. That is false. She also discussed in detail this evening about all the other alternatives to ease pain, such as 2 things listed below: music, a comfort blanket. She also offered the idea of an activity pad, which I wrote down because I think that's a great idea for my daughter and I to get ready for Homeplace's opening to do as an activity together. So music and a comfort blanket are 2 ways to decrease behaviors and to distract. That is true. And the final question, home health, which is her expertise, can be a good resource for support and treatment to decrease and prevent pain in loved ones. And that is true as well. So our next thing is This is the page that I send as a follow-up to the our monthly seminars. So this is, we had identified in the beginning the Abby Pain Scale, which is a resource that Tara had mentioned that you could use with your physicians if you have a loved one